It's no secret now that low-carb diets are an extremely effective way of losing weight, with an abundance of research showing that they significantly outperform both high-carb, low-fat and traditional calorie restriction diets. For this reason alone, it's no surprise that millions of people are switching over to a low-carb lifestyle, and tens of millions more are in the process of learning or simply gaining an interest. But despite the hype, there's one thing that stops many people from even getting started, and that's the belief that consuming fat, which is a huge component of most low-carb diets, will raise cholesterol, which will in turn clog your arteries and give you heart disease. So let's find out whether it's true. Should we actually avoid fat, or are low-carb diets like the keto diet a good idea? Let's begin by taking a look at cholesterol. We've heard it blocks your arteries, but what does it actually do within the body? Firstly, it's involved in the production and function of hormones, which is why cholesterol levels rise naturally in pregnant women who are releasing all sorts of hormones in the process of growing an embryo. It's also why this study found that men who were prescribed statins, the most commonly used cholesterol-lowering drug, had lower levels of testosterone, an essential hormone with roles in things like muscle growth, sperm production, and erectile function. Cholesterol also gives structure to your cells, as it's a foundational component of all your cell membranes. So without it, your cells, the building blocks of your body, would literally turn to mush. In fact, cholesterol is so important to the body that the liver actually produces its own whenever we don't consume enough, which is kind of ironic, given how much effort we're told to put into lowering it. So humans need cholesterol and we die without it. But how much is healthy? Surely consuming 70% of my calories from fat, as recommended by the keto diet, is far too much. Well, let's explore some evidence. Number 1. This 2001 study of over 3,500 elderly people tracked cholesterol levels over a period of 20 years and compared them with rates of death. They found that those with the lowest cholesterol had the highest mortality rate, which in the words of the authors cast doubt on the justification for lowering cholesterol to very low levels. Number 2.
This is something that I want to discuss too. Cardiovascular disease and heart attacks. The difference between the rate of cardiovascular disease and heart attacks today versus like the early 1900s. There's a giant spike, a big change.
Same as those other graphs.
In this clip, Dr. Paul Saladino explains to podcast host Joe Rogan how there's been a steady increase in cardiac heart disease since the 1900s, despite a huge decrease in saturated animal fat consumption. This suggests that saturated fat and cholesterol are not causing heart disease, and instead he points to vegetable and seed oils, refined carbohydrates, and sugar. Number 3. This study found that of 36,000 patients admitted to hospital for a coronary event, 50% had low levels of LDL cholesterol, again suggesting that something else is responsible. At number 4, we have the French paradox, which relates to France's extremely low rates of heart disease and obesity, despite getting as much as 40% of their calories from fat and 16% from saturated fat, almost 3 times the recommended intake. Number 5. According to this review of studies by 26 medical doctors and nutritional researchers, compared to other diets, going on a low-carb, high-fat diet causes many markers of health to improve. Your weight drops, hemoglobin A1C, which is a marker of pre-diabetes, goes down, blood glucose goes down, triglycerides go down, and HDL, the so-called good cholesterol, is even up slightly. Number 6. In this one, elderly subjects placed on a cholesterol-lowering diet rich in carbohydrates and unsaturated vegetable oils were almost 100% more likely to die of any cause over the subsequent 3 years of the study than subjects with higher serum cholesterol levels. Number 7. This study reveals the vital role of vitamin K2, which is found in abundance in animal fats, in removing calcium deposits from the heart. This suggests that consuming saturated fat may even have a protective effect, and helps to explain why the Inuit people of the Arctic, who survive almost entirely on seal meat, simply don't get heart disease. So heart disease is a complex process with many factors involved, but the evidence is clear: saturated fat and cholesterol are not the root cause, and certainly shouldn't stop you from switching over to a high-fat diet like the keto diet. Now, this message is clearly in conflict with what most of us have been taught, that fat is to be avoided, but the evidence is out there, and thankfully public opinion is changing too, as we see more articles like this one, and studies like this, which revealed that heart disease risk actually goes down the more saturated fat you eat. Okay, so that's it for this one. I hope you now feel a little bit more informed on the subject of cholesterol, and maybe even feel brave enough to give a high-fat, low-carb diet a try. If you benefited from this video, consider subscribing to the channel, and please share with anyone you think might benefit. As always, I hope you have a great day, and I will see you in the next one.